Health Watch is presented by UMass Memorial Health Care. Here, caring for you.
Welcome to Health Watch, presented by UMass Memorial Health Care. We're talking about diabetes, a condition that affects 30 million women, and it's a condition that affects women a little differently than men. We went to the UMass Memorial offices in Northborough to get answers. Can you explain the difference between diabetes in women versus diabetes in men?
There are certain symptoms that are unique only to females, and one of them is vaginal yeast infections, oral thrush, recurrent urinary tract infections, polycystic ovarian disease, and depression.
What is the difference between type 1 and type 2 diabetes?
Type 1 is generally diagnosed in patients who are younger. Type 2 is diagnosed in older people. In type 1, the mechanism of the disease is slightly different. It's an autoimmune disease. In type 2, the mechanism is slightly different. There is insulin in the body, but the body's tissues and organs are not responding to them very well. In other words, there is insulin resistance.
If you're a diabetic, are there complications to using birth control pills?
Often, birth control pills can lead to uncontrolled blood sugars and can cause a lot of fluctuations in blood sugars. So make sure you check your blood sugars several times a day as instructed by your doctor.
What should diabetic women look out for before and during pregnancy?
The American Diabetic Association recommends that diabetic pregnant mothers check their blood sugars very, very frequently, as many as 8 times a day.
How can menopause affect diabetes?
During menopause and even sometime before menopause, there can be many hormonal imbalances and hormonal surges that can cause surges in blood sugars and fluctuations in your blood sugars. So be careful at that time and check your blood sugars as instructed by your doctor.